Since the start of the COVID-19 pandemic, the government of Alberta has struck a balanced approach, one that protects the health of all Albertans without placing undue restrictions on personal freedom, protecting both lives and livelihood. But the fact remains that an estimated 40% of traceable COVID cases can be linked to private social gatherings. It's clear that if we want to slow the spread of this virus, to protect vulnerable populations and our healthcare system, private social gatherings are the obvious place to start. The potential health consequences of doing otherwise are simply too serious for us to ignore. And so, as Premier Kenney announced on Tuesday, those who choose to break the rules will be subject to fines. Depending on the nature of the infraction, fines could be as low as $1,000 per ticketed offense, or in extreme cases, as high as $100,000 through the court system. People need to be responsible for their own actions by treating the pandemic as serious, and so too will be the consequences for not following the rules. Developed by Alberta's Chief Medical Officer of Health, Dr. Hinshaw, to help protect you and your family and friends from getting and spreading COVID-19 pandemic. To reflect the current health risk, we are temporarily increasing the number of peace officers who can sanction fines against those who break the rules. Currently, enforcing public health legislation is handled by police, health inspectors, and Level 1 Alberta peace officers. Now, on top of this, I am temporarily extending this authority to about 700 more officers, to both certain Level 2 Alberta peace officers and Level 1 community peace officers. This means Alberta peace officers who are Level 2 and work in ministries outside of my department, and Level 1 community peace officers who are employed by municipalities across Alberta. Both already have the training and experience necessary to enforce public health orders if required during a provincial emergency. To be clear, we are not asking these officers to stop code their day-to-day priorities or to harass responsible Albertans going about their everyday lives. As the Premier said earlier this week, this is not by preference, but because of the reality we face as a province. As elected members of Alberta's government, we are simply making sure that more enforcement is available to respond quickly and decisively to situations where groups are breaking public health measures and thereby endangering the health of their community.
I think over the course of most of the last 9 months, we have seen the majority of our cases in urban centres. And unfortunately, I think what's happened in the last couple of months is that the challenges we're seeing in Edmonton and Calgary are similar across other areas of the province, with people spending more time indoors, perhaps people who live in areas of the province where they didn't really have a lot of COVID spread previously may have relaxed the precautions and felt like that particular area of the province was safe. But of course, we are all interconnected, and there are many people who travel back and forth. And so as we've had, unfortunately, introductions in different parts of the province, we have seen many different municipalities across the province moving into that threshold where they are experiencing more than 50 active cases per 100,000. So I think the bottom line is that no matter where people live in the province, COVID-19 is a risk, and the precautions that need to be taken everywhere. And that is exactly why the measures, many of the enhanced measures that were put in place are focused on those enhanced areas because we need all Albertans to watch out for each other by following these restrictions that are now in place. Turning to today's case numbers. Over the last 24 hours, we have identified 1,227 new cases of COVID-19 in Alberta and completed more than 16,200 new tests. Our provincial positivity rate currently sits at about 7.6%, and we now have 14,217 active cases. There are 405 people in hospital, including 86 who have been admitted into the ICU. Sadly, there were 9 deaths related to COVID-19 that were reported to us in the last 24 hours. I think often about the tragic impact that this virus has had on many Albertans. Not only those who have lost a loved one, but everyone who has suffered from COVID-19 or been impacted by the restrictions we have used to prevent spread. This is a hard time for all of us, and we need to continue to support one another through the many challenges.